live test of Gillet's test. Whatever, go.
Hi, I'm Dr. Tom, and you?
I'm Diamond.
Diamond, how you doing today? Diamond, we're going to be assessing your spine today, basically from the back of your head to about your belt line if necessary. And if I need to expose the skin in that region, is it going to be okay?
Yes.
We're going to assess what we call the SI joints. So what I need you to do, if you could here, I'm going to have you stand just about here, and I just need you to brace yourself up on the wall. Would that be okay?
Yes.
Okay, and just face that. Okay, comfortable?
Mm-hmm.
Once again, it's okay if I expose this region here?
Yes.
Okay. So what I'm going to do, and the hands are cold, I'm going to palpate, windshield wiper down, PSIs. From here, I'm going to assess flexion of the right SI joint, the upper pole. So I have a PSIS and I have the S2 tuber. Do me a favor, Diamond, if I could, can I have you raise this leg about 90 degrees and lower it? Once again, just raise and lower it. Beautiful. What I feel in this case is she's moving normally. The PSIS, the ilium, is the first to move, and the PSIS I felt move both downward and inward as if towards my other hand. I'm going to assess now, I'm going to assess flexion of the lower pole of this right SI joint. So now I'm going to palpate down to the PIIS. I'm going to come to the S4 tubercle. Once again, if I could, Diamond, could I have you raise this right leg? And bring it back down. And one more time. And back down. And again, she's moving normally, and that I feel the PIIS actually travels both inferiorly and slightly anteriorly. Now, personally, I feel a little less movement or excursion in the lower joint than I do in the upper joint, and technically that means that the axis of rotation has shifted subtly towards the less, in terms of where I feel less movement. Now I'm going to assess extension of that the right SI joint, the upper pole. So I'm going to contact the PSIS and the S2 tubercle. This time, Diamond, if I could I have you raise the left leg past 90 degrees? And down. One more time, if you could, raise this leg past 90 degrees and down. This time, I feel her sacrum is the first to move. It does move slightly backwards and actually a little bit inferiorly. It's normally what I should feel. I'm going to contact now extension of the lower pole of this right SI joint. So my contacts are going to be, once again, the PIIS on the right and the S4 tubercle. Diamond, if I could, once again, I'm going to have you raise this left leg past 90 degrees and down. And once again, and down. I feel her sacrum, actually the S4 tubercle is the first to move, her sacrum is the first to move, and it feels as if it drops slightly down. Once again, I feel a little less excursion in the lower pole of the joint than I do in the upper pole, and it implies a problem with her, whether it be flexion or extension. It seems that the axis of rotation is shifted a little bit inferiorly. Now, on your thank you very much. On your examination, you're only going to get one motion. So, for example, we would say we want you to assess extension of the upper pole of the right SI joint. So remember, you're not going to go through the full movement. You'll just be giving one aspect of it and have to be able to describe it.
Very good.